Hello again, Dr. Jared, physical therapist, lead physical therapist with TheraNow, here to give you some more tips this time on building trust in your uh, in your patient on your first call. So, in virtual care, trust doesn't automatically carry over from your credentials. It has to be built quickly and intentionally within the first few minutes of the session. And most of that comes down to how you start. What we typically see is a quick informal start. Hi, how are you? All right, tell me what's going on. Then the session begins. There's a little structure and very little intentional trust building. And that opportunity is definitely lost. So over time, this unstructured approach is basically the default. And and we think as long as we're clinically competent and ask the right questions, trust follows, but in virtual care, that assumption definitely does not hold. Patients don't have enough context in a virtual setting. They don't know you. They don't know your experience level. They don't know what the process is going to look like. They don't have the smiles from the receptionist. They don't have the pleasant music in the background. And many patients, really, honestly, are unsure virtual care is legit and will even work at all. So, if trust isn't established early, engagement and follow through with patients really suffers. So, instead of starting casually, we need to structure a way to establish trust immediately. Start with a clear introduction, your name, your role, and what the session is going to consist of, what it's going to look like. Set expectations early so the patient understands the process. Next, talk about your credibility. Brief but specific enough to build confidence. Therapists can leverage their degree, any formal training, relevant certifications or specialties, years of experience, experience treating the particular case of the patient that they're seeing. If it's plantar fasciitis, I can tell them I've seen hundreds of plantar fasciitis patients, and I'm your guy. I know how to do plantar fascia pain. You can talk about your success as a whole in the virtual setting um, with orthopedics. The goal is simple: make it easy for the patient to trust that they're in capable hands. Uh, the next thing to do is to validate virtual care as a whole. We really got to touch this one. So, address the virtual format directly. You can let them know, understand if you have any doubts. But with TheraNow, there is no compromise in care delivery. Patients are always treated by a physical therapist, never passed on to an assistant, which will compromise care potentially. Care is consistent. You are not shuffled between multiple providers, which definitely can compromise care. Sessions are fully one-on-one with no divided attention between patients, and that definitely compromises care if you're one of two, three, four patients, which is really common in the outpatient setting. And most importantly, research consistently shows that virtual physical therapy is as effective as in-person care, especially for the types of conditions that we treat. This removes doubt and reinforces confidence in the patient. So here's an example like flow, something I might say. Hi, my name is Dr. Jared. I'm a physical therapist. I have a clinical doctorate in physical therapy and a license to practice in your state. I'll be your physical therapist today. I'll start by understanding what's going on with a in detail interview and an examination, and then walk you through a plan to fix it. I have 10 years of experience working in orthopedics, 5 of it just in virtual care. And I've worked with so many patients dealing with similar issues as you're experiencing, so I'll be able to tailor your treatment specifically to you. Just so you know what to expect, your care here is always one-on-one with a licensed physical therapist. You won't be passed around between providers, and I'll be the only one working with you each session so we can track your progress closely, and you can always work with the person that knows you best. Even though this is virtual, research shows it's just as effective as in-person care for cases like yours and many, many, many more, the vast majority. So you are receiving no compromise with being in virtual care. You just don't have to drive anywhere, and you just have to open your app and log right in. So this script here, these points that I'm making, this takes like 30 seconds in total, maybe a minute if you get on a tangent or any questions arise, but it completely changes how your session starts. Now the patient understands who you are, why they can trust you, why virtual therapy is legit, and they can definitely trust ritual therapy, and they know what to expect. That foundation directly improves engagement, confidence, and follow through. Thank you.